So good afternoon. We are in Negril Yoga Centre in Jamaica, and we are just kind of in the middle of finishing our core level 3. And I've got Noah Karrasch, and I've had a bunch of questions that I've been wanting to ask him. So I get to ask him now. I'm so excited. Okay, ready?
Certainly.
What is core bodywork?
Well, core is my own evolution of bodywork. I trained as a Rolfer in 1985-6, and I liked the work of Rolfing, but I kept going, something else will work for me a little bit better. So CORE is what I've created over the years. My acronym is Cope's Order, Restore Energy, and my concept is we all want to touch the core of the being that we're working on as a deep tissue body worker, but we want to touch it in a respectful way so that we get to the layer where the client goes, oh, something's happening here, isn't it? And then invite them to let go. So the whole work is involved with trying to touch the core and getting people to relax the core.
Why is it called core? Or you just mentioned...
Well, yeah, I kind of mentioned it, but again, let's go back to, I really almost absconded with that word from John Piracos. John Piracos created the work called Core Energetics, which was more of a psychotherapeutic, but bring your body into your psychotherapy. So he was a student of Wilhelm Reich. He and Alexander Lowen created bioenergetics, and then Piracos went off and created core energetics. As I understand core energetics, Piracos said we are three-layered beings. The core is the center of right energy. The second layer is the body, and the third layer is the environment. And he says that most of us are using our bodies to protect our cores from our environment. And so in my head, whenever we are looking at core, we're trying to get through the body and make it safe for that core to find that environment.
How long have you been doing core?
I trained in 1986, completed training in 86. I had picked up Ida Rolf's book for $1. I came to the line that said, this is the gospel according to Rolf. When gravity gets flowing appropriately through the body, then spontaneously the body heals itself. And I thought, wow, that makes so much sense. So immediately I called the people and said, I want to do that. And that was 1986 that I got my certification in Rolfing. And then along about 92, 3, I went, I'm a little different from these people. I see things differently than these people. And so it was about 92, 3 that I've started off on my own core path. I started calling it core massage. Then I thought, no, this isn't a massage. And then I started calling it core bodywork. And then, of course, since we're talking about fascia so much anymore, I started thinking of it as CORE Fascial Release. But frankly, the longer I go, the more it's core work. Because we just want to get people to find their cores and work from them.
So that started when you decided
the core work?
To call it the core work?
Probably only about 3 years past.
3 years past. What is the procedure?
Well, I have a 1-session recipe that I think is fantastic, which entails trying to soften the core, access and soften the core on the front of the back of the body, and then see all 6 points of a star, arms, legs, head and tail, and get people to soften and open the core so that all of those points can expand and take up space. So that's my 1-session recipe. I also created a 5-session recipe with very specific goals for each, but it makes a couple of good trips through the body and gives us an opportunity to enhance and advance that recipe. But the whole concept is, can you get people to let go of whatever their traumas are deep down, the physical trauma, mental, emotional, chemical, electrical, energetic trauma. Can you let go of your trauma so that you can let energy flow through your body happily?
And what is the difference between core, Rolfing, and other myofascial release therapies?
We're all working with fascia, and fascia is the connective tissue, which is to say the wrappings of the muscles, the wrapping through the muscles, the wrappings around muscle groups, the wrappings through the organs. So the fascia is this connective tissue webwork. Makes perfect sense that we're all working with fascia because I believe it is the medium that stores the trauma. Among the ways I see myself as different from Rolfing is that a Rolfing series traditionally is 10 sessions. We do a 5 series. So we're taking a little bit less of your time, your money, your energy. Generally speaking, we keep people clothed, whereas Rolfers usually work with people down to underwear. Part of that being because we're very interested in creating safety for the client. So people are more interested in and willing to let go of their trauma when they feel safe. And so primary for us is creating safety. I didn't meet Ida Rolf, but my understanding is she wasn't very worried about either your safety or your pain levels. We're always monitoring safety and pain levels. Movement, we really focus on breath and movement. You've got to get people breathing through their body as you're working with them, because literally if you're working too hard, too fast, too deep, you've just taken their breath away. That doesn't do much good. So breath work and movement, if we think about a rubber band, when you stretch one end, nothing happens. When you stretch two ends, you get more stretch. If you stretch and pull, you get more. And if you put something else in the between, the more direction of stretch that we can create while we've got our clients working, the more we get done. And last, I would say, is I believe in homework. I'd probably more fully call it home play, where I suggest that somebody goes home and thinks about this, or think about this. And I'm less likely to say, go home and work on this, and more to say, now go home and explore this. Go home and play with this and see what we can get.
Who would CORE appeal to or benefit?
Yeah. Well, the short answer is everybody in the world.
Yes.
But the longer answer is a lot of people aren't particularly interested in making changes in their world. A lot of people are looking for a magic bullet. A lot of people are looking for a pill or a surgery that's going to fix everything right away without any investment on their part. So core work, I think, is going to appeal to people who are willing and ready to take some responsibility for their own healing. So that will entail not only going into the layer of your body that you think, I'm not sure I want to look at this, but then doing something with that layer. Now, having said all that, I think this is good work for back pain, neck pain, shoulder pain. I think this is good work for people who are in psychotherapy and want something to enhance that work, or people who are alcoholics and working through their program. This is another way to help them crack that body shell. So there are very few people who wouldn't benefit from the work if they're interested in doing some work.
When you talk about fascia, you talk about the body, but to who it benefits, you're talking more than physical.
Absolutely, thank you.
There's emotional and there's psychological too.
Well, as I said earlier, trauma is physical trauma. Yes, I just sprained my ankle. Yes, I had a whiplash in the car wreck. Yes, I broke my arm. But there's mental trauma. Oh my God, I've got so many tasks. I don't think I can get all these things done. There's emotional trauma. Why do they hate me? Why aren't they treating me well? Why do I feel like the world is against me? There is chemical trauma, fluorescent lights, new carpets that outgas, toxicity in our foods, energetic trauma. This person just makes me go tight and protect myself. So there are so many forms of trauma. I want to appeal to all of those forms of trauma. I want to try to help people figure out any of those forms. In the class, we came up with a new concept. There are bits of our bodies that go on strike. Be it a muscle in the leg that says, ow, I stepped on a thorn, and I've bruised my foot, and I don't want to put my weight down on the inside of that foot, so I've learned to walk around that foot, and I've never bothered to put it back under me. There's a muscle on strike. There was a trauma. There's an emotional trauma. I don't know why we had you. You're never going to amount to anything. Ooh. And we learned to sit this way. a young girl who develops breasts before all the other girls, or who develops her height while everybody else in class is so short, will try to figure out how to fit into the world with everybody else. So we're all carrying so many different aspects of trauma. And most of our parents, including me as a parent, weren't that good at saying, oh, that was a pretty hard trauma you just took. Why don't you have a breath and let that go now? Didn't happen in my world.
Yeah, doesn't happen in a lot of people's world.
Yeah.
So then core body work would help to, in a way, release that through movement and breath and...
Absolutely. Get more movement, get more breath, get more energy. If there's one problem in the world and it's congestion, how do we create circulation of the physical, mental, emotional variety? And so, yes, our goal is always to get people longer, straighter, taller, breathing more fully, moving more freely, and feeling more happy about life and on purpose.
How do you train people in this work?
Mostly I train massage therapists, although I have occasionally people who are not massage therapists, sometimes just lay people, sometimes Pilates people, sometimes yoga instructors. Occasionally a doctor or a chiropractor will come for some training. I have quite a few 6-hour days with very specific ideas, such as psoas, storer of all stress. Psoas being my favorite muscle on the front of the spine to the inside of the leg. And I literally do think that it is the primary flexor of the body that stores stress. So there's a 6-hour day where I teach people how to access that psoas and release it. We have a jaw and neck day to try to get the jaw to let go. We have a shoulder day, we have a knee day. So there are various 6-hour days that are good one-off for a massage therapist who wants to enhance a specific skill. If someone gets interested in me and this work, I have a 4-layer training. Core 1 is 16, 18, 20 hours, and it creates and teaches this one session recipe. This touch the core front and back and then pull all the points out of the star. Core 2 is 3 full days, 24 hours. And in Core 2, we really go back and review that recipe, hopefully 4 to 6 months after they've taken Core 1. But in addition to reviewing the recipe, we also work with a lot of technique. Here's a good trick to get that knee to let go. Here's a good way to get some breath into the ribs. Here's a good way to work on the front of the neck. So we've got a series of technique ideas in Core 2. Core 3 is where we start separating the men from the boys, because Core 3 is 60 hours in 6 intense days with 1 day off in the middle, and that's where we learn and practice the 5 series recipe on each other. And then Core 4, 72 hours, adds a little bit on each end of that, and we go back through that recipe. But at the end of Core 4, I say, good, now you know everything I know, and you all already knew a little bit, so you go out and do it better than I do it. But by the end of 1, 2, 3, 4, and I do ask people to do them in order of 1, 2, 3, 4, prereq, prereq, by the end of that time, you're going to be a better body worker. You may not look like me, but you'll be even better at what you were.
And what is the criteria if somebody wants to get in? You already said that some people come in anyway.
Other people come. Here's the thing. I've never bothered to become a trade school, and so I have no ability to credential people as a licensed massage therapist, for example. So people who come, by and large, yes, they can get continuing education credits as massage therapists, but I cannot give them a trade school certification, so they need some other credential if they want to go out and practice in public. But I also have people who say, no, I just want to do this on my family. I just want to work on my friends. And then, as I said, I have some Pilates people who say, no, I just want to try to bring this into my Pilates training.
And how many core body workers are there in the world?
Not that many.
Yeah.
We've giggled about this. I'm no salesman. Never have been, probably never will be. I think I've got some good stuff here.
Yeah.
I'd say there are about 10 people who are certified at a level 4 and probably 20 at a level 3 and probably 150 or so at a level 1. Something along those lines. I'm not good at keeping a directory. Recently, I asked people, and a lot of people who have taken a 1 or a 2 are saying, yeah, I use those techniques, but I don't feel competent to be on a directory. So a lot of people have gotten a little bit of information, and a few people have gotten a lot of information. But when somebody hits level 3 and 4, generally speaking, they know something.
Where do you see core bodywork go in the future? Where do you see it going?
Well, where I see it going is I hope that we can affect mainstream medicine. And medicine is not even one of my favorite words, although I shy away from the word healer or healing, but what we're trying to do is healing. And what I'd like to think is that we can start influencing other groups of people to realize how important breath, movement, client participation, creating safety, getting that person involved in their process, and rewarding them for trying to make changes in their world. So where I see us going is I think I've got a good group of people who are now interested to move forward with the work. But even if it doesn't move forward as core work, which is frankly kind of a generic concept, you know, I can't patent the core because we've all got one. But I think that if we can start influencing other schools of movement and body work and healthcare and healing to start really looking at taking care of their client, their patient, their patron, start tending to their safety, start really tending to their core needs and listening to them and communicating them, that even if it's a drop and it's one ripple, it's going to have a good effect. I'd like to think that the new generation, and I am the old generation, I'd like to think that new generation is going to take this and do some amazing things.
I like to think so too.
I believe it will happen.